Okay, can you see the slide right now?
Yes.
Great. Okay. Hi, everybody. Thank you so much. First of all, it's an honor to be here, and we appreciate the invitation. My name is Jessica Blanchard. I'm with the University of Oklahoma, and we are coming to you from Norman, Oklahoma, which is the traditional homelands of the Caddo Nations in Wichita and affiliated tribes. So we thank you so much for allowing us the space to talk here today. I'm going to be talking to you today about some work that was performed as part of a broader consortium that we're a part of. I am here on behalf of the Center for the Ethics of Indigenous Genomic Research, and also known as CIGR. And I'm going to be talking to you today about deliberations about genomic research in 3 tribal communities. This was a specific approach to community engagement that we at the Center for the Ethics of Indigenous Genomic Research have been working on for the past few years. You can see my list of team members there underneath presenters. I think that some of us, multiple of us are going to be speaking today, but I want to acknowledge the whole team, which is listed there. So the Center for the Ethics of Indigenous Genomic Research is a consortium of tribal partners and university researchers and community-based institutions, native serving organizations that are focused on systemic inquiry into tribal concerns about genomic research. The consortium is one that is continuously growing, and so the work that I'm going to be talking about today is actually based on work that was done when our consortium consisted primarily of researchers affiliated with the University of Oklahoma and 3 community partner sites, the Chickasaw Nation of Oklahoma, South Central Foundation, and Missouri Breaks, which we'll speak more about as we continue. Our consortium really seeks to conduct research that is partner-centered, emphasizing in our work equity and community control, manifested in part by distributing power and decision-making across all of the partner sites. And in doing that, we also sought to develop a scope of work that worked for all of our partner sites. And so in thinking about an area that we all wanted to explore together, we considered utilizing an approach that was new to most of us, and that was deliberation. So deliberation is a specific method used to elicit informed perspectives on complex issues. It is a form of engagement that brings together diverse citizens for in-depth dialogue and discussion about public policy challenges. It's really useful, as this first line says, to get to some of the underlying values that inform citizen perspectives. And that was one of our goals in using deliberations across the 3 unique tribal community sites, was to convene together citizens from each of those communities and really dive into issues having to do with genomic research in ways that allowed their unique perspectives and values to float to the surface and really give us a richer understanding of the diverse perspectives that existed in each of those communities. Even though we were using the same approach at each of the sites, which was deliberation, we knew that there were going to be some unique distinctions across each of the sites. And so one of those distinctions was that each site chose a different topic, all of them having to do with some aspect of genomic research, but something that was specific to each of their communities, that was responsive to their concerns and their priorities, but that also had great relevance to them locally. And so we knew that those questions would have some variation in them, and we expected that to be the case. We're going to introduce 3 of the sites to you today and talk a little bit about the different topics that they addressed. I'm actually going to turn it over now to my colleague. We're going to try this.
Keep controlling the...
Okay.
Okay, good. Let's see. Thank you. Thank you, everyone. My name is Justin Lund, and in fact, I'm part of the OU core team that went to each of these 3 sites and helped our communities perform these deliberations. Normally, we would have a member of those specific locations
Sorry.
present their work, but we weren't able to get them in time for today's presentation. So I'm just going to share with you some of the results that we had from our first deliberation on the Chickasaw Nation.
Can we get an indication from the moderator if the voice is, we're having some technical issues, I'm afraid. I can't see anybody, so.
Yeah, Jessica, could you just mute yours?
I
And
can't.
Justin. There you go.
Okay, and so these deliberations, these 3 deliberations that we had conducted, kicked off in September of 2018, and on these 2 days events, on September 14th and 15th, with our recruitment was for enrolled members of any federally recognized tribal nation that resided within the Chickasaw Nation boundaries, which is a 13-county jurisdiction here in Oklahoma. Our forum was designed for citizens to consider the potential risks and benefits of participating in genomics research and biobanks. We had 16 participants on the first day, 10 women and 6 men, or 16 participants on the first day, 10 women and 6 men, and 15 participants on the second day. We had 1 member that couldn't join us on the second day. After deliberating on the first day, the deliberants were posed the question, do the potential benefits of tribal participation in genomics research outweigh the potential risks? And being polled, we arrived, after a lengthy discussion, the participants decided 15 out of 16 that yes, the benefits outweighed the risks of genomics research. On the second day, we similarly at length discussed the benefits and risks possible with biobanking. And when posed at the end of the day, the question, do the potential benefits of tribal participation in outweigh the potential risks? And we had a vote of 13 out of 15. As you can see, we've included some of the participants' expressions that they gave to us, which are further included in our journal article. But some of the risks, even though they were in favor of both genetics research and biobanks, some of the things, the concerns that they raised were around data control, data sharing, consenting, as well as long-term storage. These conversations were incredibly fruitful, and I believe many of the participants expressed an appreciation in being heard. You got it.
All right, thank you, Justin. Julie, did you want to speak about the work at South Central Foundation?
Yes. All right, so at South Central Foundation, this community engagement was designed in the form of a public deliberation, and we sought to increase participants' understanding of genetic research and return of results in relation to each individual, family, community, and to capture community members' comments, concerns, and possible utility of genetic research and return of results. Our previously published qualitative work at South Central Foundation shows that the Alaska Native and American Indian community members are interested in receiving results from health research projects at both the community and individual level. So the return of genetic research results does raise important value-laden questions for the Alaska Native and American Indian community to consider. And so we wanted to introduce and test public deliberation as a form of engagement and engage in a meaningful discussion on the complex topic of genetic research, testing, and return of results with the Alaska Native and American Indian community at large, and to elicit some community member perspectives on genetic research, testing, and return of results. So day one of our deliberation, participants were presented 2 cases that generally described a situation to consider about the genetics and genetic research. And then day 2, participants were presented with 2 situations that challenged them to consider the situation where one could receive confusing, distressing, or problematic results, both clinically as well as some direct-to-consumer scenarios were presented. And each group thoroughly discussed a scenario and the potential implications. This deliberation process allowed time for participants to really think through and ask questions about what is genetics, and then move forward into an in-depth discussion on what genetics research might mean to them individually, to their families, and to the community. Participants saw potential for genetic research and testing to empower and improve the individual, improve health at the individual and the population level. But participants also expressed hesitation regarding genetic research and testing and described it as a possible opportunity to expose individuals and communities to privacy breaches of personal information, discrimination, and emotional harms. Much of the discussion highlighted the collective impacts of genetic testing, and it had less to do with the potential for collective benefits, but more to do with the potential for collective harms. And this included the shared histories of trauma, communal harm associated with loss of traditional dietary practices, and damage to shared environments. Our findings demonstrated that not only the extent of the complexity involved with genetic research, testing, and return of results in a tribal setting, but also community members' ability to discuss and weigh the complex considerations involved with genetic research in a tribal setting. While none of the community members had any formal training in the topics of ethics or science of genetic research and testing.
Thank you, Julie. Sorry, guys, as we navigate these techno issues. Okay, I'm going to move on to our third partner site. And we actually do have one of our representatives from this site here, although I'm not sure that he has audio access. Joseph Iracheta, I'm texting with him now. I don't think he does. So apologies for speaking on their behalf, but sometimes that's what happens in these kind of platforms. So I'll introduce the work here at Missouri Breaks. So Missouri Breaks Industries Research Incorporated is a private research firm that is located on the Cheyenne Reservation in Eagle Butte, South Dakota. And we knew that going into the deliberative work at Missouri Breaks, which happened to be the third of the 3 that we did, that we wanted to use a consistent approach to the deliberation as we had with the previous 2 sites. There were some very specific commonalities that they all had. So for example, each of the sites had a community-based facilitator so that at each site, a community member was acting as a community member, but also facilitating the deliberations itself. And we maintained that here at Missouri Breaks as well. But we knew that one thing that was going to be very different was the kinds of questions that were asked here. And in part because Missouri Breaks represents a very different kind of partner than South Central Foundation or Chickasaw Nation, who were both health delivery systems who were serving diverse tribal communities. Oh, Joe, are you on now?
Yeah, I think I am.
Oh,
can you hear me?
Well, I'll turn it over to you then.
Thank you for whichever technician got me hooked up. So yeah, in addition to what Jessica was saying, so Cheyenne River Sioux Tribe and the work that we're doing with them is a little bit different from the other Seeger partners in that we do not have a 638 tribal health system, and the tribe generally has little control over the research process. The Indian Health Service, the hospital building, which houses both Tribal Health and the Indian Health Service, and Missouri Breaks are all separate entities. And so in terms of the SIGA working group, we represent something a little bit different from the other two groups. And so Missouri Breaks is kind of in this third space to carry out this research. We chose the topic of data use and data governance because we are in this kind of transitional space, and we are trying to help the tribe build more regulation and more of an integrated governance system. And so we, especially over genomic data, and so we picked this topic so that we can talk a little bit with the community over these issues. We did a very rigorous selection process where we tried to randomize the participants as much as possible to represent all 6 districts of the reservation, get a fairly balanced participant group, both male and female, and age groups. Also people who consider themselves traditional and those that consider themselves more assimilated. And so the group went on to talk for the 2 days over data in general on the first day, which was all tribal data, whether it was research funded or not. And then the second day, we moved into discussions about genomic research data specifically. And the first day was highlighted by not only some discomfort from the participants, but also a slight misunderstanding over the topic area because some of the participants felt that they weren't educated enough or at the level of a decision maker that they can speak cogently about the issue, but we took care of that on the first day. And then as we moved in to the second day, there was a lot more vibrant and heated discussions about data and who it belonged to, both in terms of collective as the Cheyenne River Sioux Nation, but also as individuals within the Cheyenne River Sioux Nation. And by the end of the deliberation, there was an increased level of relationality and camaraderie, and people actually voiced several approvals of the deliberative process, that they wanted to use the same method for other issues that required communal discussion between the tribal governance and the community, and then also federal authorities. So overall, it was both an educational and a informational activity.
Awesome. Thank you, Joe. I'm going to end here. I know that we're coming to our time here. I wanted to just put up some excerpts from participants from some of the deliberations and one of the co-facilitators, just to give you a sense of what their experience was. I know that Justin previously spoke about that. So I think that what we would conclude with in saying is that as an approach to facilitating dialogue and promoting engagement with communities, the deliberative method was a new one for us, but it produced very rich conversation and allowed very deliberate deliberation, if you will. I mean, hence the term. It allowed participants to convene together and really think about and process and inform one another and bounce off of each other ideas about very complex topics that were locally meaningful to them. And so it's an approach that we found to be useful. The utility of it was so much so that we're continuing our deliberation work in new partner sites and planning those as we speak. So we're happy to address any questions if you have them. Also, I include some citations for publications about our deliberation work specifically. And you can also follow up with me or any of the others afterwards if you'd like more of these. So thank you so much for your time.
All right, thank you very much for the presentation. We have time for a few questions, and we will also have time for questions at the end for both presentations. So if as the next presentation is getting started and you have any questions, you can go ahead and type them in the chat, and we'll address them at the end of the second presentation.